I have the distinct pleasure of introducing Susan Noyes, and she gave me the shortest bio ever for the most fabulous person.
I don't remember doing it.
Should have been a page, should have been a whole page.
I don't remember doing it.
Susan Noyes has been an occupational therapist for 41 years. You're brave. Say that.
You know what? I'm proud and I'm wearing it. Yeah.
She has always been passionate about the art of OT practice and has been a trained facilitator of visual thinking strategies, VTS, since 2018. Susan facilitates VTS with her OT students at USM and completed a research study on using VTS as a method of teaching clinical observation skills. So we're really excited to have Sue as our last speaker today. Thank you so much.
Thank you. Thank you. Thank you. Have a wonderful night today. All right. Thank you. Where's my people? Where's my people at home? So there's a handout going around. Everybody should have one of those. And for folks at home, Amy, I don't know how, on the conference homepage, it is called the, what does it say on top? It doesn't actually say the name of it. It's a checklist that looks like this. It's the Kentucky Inventory of Mindfulness Skills, and it says Bayer 2004 on the top, if you're looking for it. It's a 3-page checklist. So get that and hold it for a moment. I've gone back and forth about whether we'll take the time to actually do it, but I think given that we're the last session of the day, and also I think that the inventory helps to get your head into the idea of mindfulness and some of the language of mindfulness, I think we will do it, but we'll do it in a second. Okay, yes, so the introduction was good because that said a lot of what I now don't also need to say. Amy, where did the little thing go? Uh-oh. No, well, there's no remote. The remote went away. The thing. Yeah. The arrows will not do it. Let's see. Nope. Who said that? Thank you. Objectives, just because, thank you. It was here and then it left. What are we trying to get at here in our last session of the day? This has been such a rich day. I don't know about you, but and in all the ways, each individual session, but also how they, without even, it's not true that without knowing, the fabulous conference committee knew this would happen. But the way that the sessions have intersected with each other and integrated with information. So basically it works that I'm here at the end, because what I'm trying to do here is I'm not going to use the word resilience, but I'm going to take sort of direct aim at a part of resilience, I think. And so we'll talk a little bit more about mindfulness and how that can play into your clinical observation skills as a way of using these visual thinking strategies, which I hope by the end you'll have some sense of how you might, the idea of VTS is to do it in a group, which we're going to do today, but I also think there are elements of it that you can use yourself in your everyday practice. So first of all, we're going to talk about clinical observation. What is it? It's another one of those things, like I said in one of the sessions earlier, that we use phrases all the time, like meet your patient where they're at, right? We all say that, we teach that to our students, and we all know what it means. We think we know what it means, but we never really defined it, right? Same thing, I think, with clinical observation. Well, your clinical observation is your best tool in your tool belt. I always say that. I'm like, oh, right. And I know that, but it made me look up some definitions, because we seem to be doing a lot of that today. So the legal definition, should you ever need it, the legal definition of clinical observation means ongoing observation of a patient's condition by a licensed healthcare professional utilizing a medical skill set while continuing assessment and care. Doesn't that sound super legal and super medical law, right? But I would also argue it is what we do, right? It does define it in the broadest sense, I think. So, okay, we got our heads in that. We all know what we're talking about when we say that. Then what is mindfulness? Well, much like resilience, what we learned today, resilience you can define about 500 different ways. There are also about 500 at least definitions of mindfulness. But one that I thought sort of landed where I wanted it to land for today was an awareness practice originating in Buddhism. Mindfulness is framed as a scientifically verified way of cultivating a skillful engagement with life to support mental health. So they put in support mental health at the end, which I believe to be true for mindfulness, but also I'm going to obviously expand the idea of that beyond mental health into our literal practice skills. So this is a whole other scholar's take on mindfulness, but again, it's pretty similar. So if mindfulness is defined as the awareness that emerges through purposely paying non-judgmental attention to present moment experiences, every single word of that matters, right? It's actually telling us what this should feel like. Then we can talk about the multifacets, all the facets that are involved in mindfulness. So conscious observing. And here, when I start talking about this, I want you to actually also hear this through the screen of picturing yourself doing clinical observation, okay? And see if some of this starts to like click for you or connect about like, oh, I do that, or no, I haven't done that, or whatever. Because I'm thinking conscious observing. Well, I think we pretty much are doing that. Attentive observation, we're doing that too, of internal and external experiences. This is where I start to think about clinical observation is more than just what we're seeing, right? It is what we're seeing. It is what we're visually observing. But I don't know about you. We all do. You are doing it with all your senses, right? We are 100%, no matter what setting you're in. You're smelling things, you're seeing things, you're hearing things, you're feeling things. It's a full-on sensory experience, right? Then the other things here, acting with awareness, non-judgmental acceptance, and self-knowledge and self-awareness. This is all, parts of mindfulness too, that we can break. When we look at mindfulness, what is it? We can break it out into these elements. But today, for the purpose of this exercise, we'll be looking at the observational parts, the conscious observing and the attentive observation. And guess what? You can measure mindfulness skills because someone took the time, Bear et al. Took the time to develop, there are lots of them now, and we saw one earlier. Someone's presentation had it was yours, a mindfulness inventory, which was different than this one. I was happy to see. So there are lots of them. This KIMS, the Kentucky Inventory of Mindfulness Skills, was developed in 2004, I think, to look at the areas. We're doing it? Yeah. To look at 4 areas involved in mindfulness, one of which is observing. So when research is done on clinical observation or observation skills, the KIMS is often used as part of it because one of the scales on it is strictly about observing, but also describing. So it's one thing to observe and to see what you see. It's another thing to be able to articulate that after the fact, right? So you see it, and you either, as an OT, you're either having to articulate that literally out loud in a meeting, or you're articulating it by writing it in documentation, but you have to be able to translate that visual observation into describing. And then these other elements of mindfulness involved, acting with awareness and accepting without judgment. So I think it's a 39, you've got it now, the KIMS, the 39 item self-report inventory. Will you get a score on an overall score on the KIMS? No, there's no like award-winning KIMS score. No one's going to leave here today with like the gold medals. At Yoda today, I got the gold medal in mindfulness. That's not happening. What does it do though? Within those 4 scales, you will get a score that gives you some sense of where are my actual strengths in mindfulness right now? Where are maybe some areas that I would look at doing more in? So it's that kind of a self-report, right? We're not diagnosing anybody around mindfulness. So I think what I set it up here to do, just a little more definition here of the 4 terms. So what does the KIMS inventory mean by observing? So noticing or attending to various stimuli, including internal phenomena, right? So here they are giving some credence to this idea of observing as more of a full body experience than just our visual system, right? Which I think for OTs is really good because I know that's what we do. Even if we're not thinking about it, that is what we're doing. Describing, like I said, being able to then describe, label, or note your phenomena by applying words in a non-judgmental way. This speaks right to this idea of how objectively we need to write our documentation, right? I think we're really practiced at staying in the non-judgmental space, But I also know that it's an area that no matter how long you've been in OT, it can still stand, you can still tend to check that every once in a while and to continue to evolve that. They define acting with awareness as being attentive and engaging fully in your current activity. So being, my favorite phrase, be where your feet are, right? Can you be in the moment you're in? Can you be doing the thing that you're in right now? And yeah, when we're here and sitting and thinking about that, I think most of us can. But you start getting busy in your average workday, and how hard is it to be where your feet are? Because your feet are all over the place, right? Understood. But the more you practice this skill set that goes with that, the more your brain starts to train you into thinking about it, right? Even attending to the idea that, am I right now being where my feet are or not? And this, for those of you familiar with dialectic, and I always want to say diabolic, and it's not diabolic, it's dialectical behavioral therapy. This acting with awareness speaks to a couple of the real important elements from DBT as well. And then this accepting without judgment. So it's the allowing the reality to just be there. I mean, you may have heard the term also radical acceptance. I kind of think of accepting without judgment as just radical acceptance. This is what it is right now. What I'm looking at, it just is what it is, right? And being able to stay there. So I think the next one is having us, yeah, let's not do that yet. I don't know how to go backwards because, uh-oh, oh no. Anyway, that's good. It's good time. Amy knows. But this is good timing because I'm going to give you a few minutes now to actually complete the Kims. Let's say, you know, till 3:45, 10-ish minutes. I know it won't be enough time. I want you to reflect fast. Did I unplug it? Unplug what? All I did was hit one of the arrows. Looks like a mix. So, put this back in here first. Go backwards. What are you able to?
So which
the
one?
arrows?
Yeah, so left is back, right is forward.
Right, but the arrows weren't working for me. I was actually using the space. Okay,
I took this from you and hit it because it was a fun game for me.
okay, as long as that, good, I'll use these. That's fine. That's fine. I just, yeah, it wouldn't go backwards, so it's weird. Oh, it's okay. That's fine. I'll use this one.
Well, do you want it for the slides or?
No, as long as the arrows work, I'm good.
Lisa said you missed it. I wanted to make sure you had everything.
I was just, no, I was gonna make sure
You
you
have all that you
here.
required.
Thank you. Well, and you also learn to respond to my, oh no.
Here it is. Coming soon.
Thank you. When you get to the scoring part where it has the items highlighted in green, many of you will have them highlighted in gray because I didn't turn the color on for the printer. And also note that some of them have to be reverse scored, which means you basically flip. If it was a 4, then it's a 2. The cognitive assessment for the end of the day. You don't have to total your totals. No, it's like a score for each scale. You should have like 4 numbers. Yeah, yeah. Unless, Missy, you want the gold medal for mindfulness, you probably should get it today.
But I'm not getting.
Yeah, you don't need to total when you're at the scoring, you don't need to total the 4 numbers, you should just have 4 numbers, 1 for each of the scales. Unless you want the gold medal in mindfulness, in which case we'll see who gets the highest. Yes, 3 stays 3, yes. No, I know it's up. Why would we do this at the end of the day? How are we doing? We need another minute or so? Well, no, we need a whole half a day or a day split, right? Trust me, the irony of saying, quick, rate your mindfulness and reflect on it really fast. I'm on to it. That's like. If you have finished scoring, I have some just reflective prompts on the bottom of this slide, just to think about what you see in your inventory. Again, it's self-report. It's not diagnostic. We're not turning it in. But does it tell you anything? So it sounds like we can probably get started again. If you didn't finish it, you're certainly welcome to finish it at a more mindful pace later. But the idea was to have you go through, what are some of the, even the items that they would ask you that relate to mindfulness? What, how is it that they broke it down to determine these 4 categories? And you can see, obviously, when you get to the scoring, which questions were meant to address which thing. So this whole slide show is on the, will be on the website, wherever they posted it. And so you'll have access to this again if you do want to go back and look at it more. I am just super curious though, if in a group of OTs this big, I've not done it with a group of OTs this big before. How many of you had higher or your highest scores in observing? I thought so. I wondered if that might be at least mostly true, because I think, it's one of the skills that we learn in OT school, but we don't ever, at least till recently, I've never explicitly taught it. We assume, I think, that OT students come into school like, well, by definition, you're an OT student, you're probably relational, you're probably intuitive, probably have good observation skills, I don't know, right? But we teach all the other things, but we never really teach that. So when I found out about visual thinking strategies, I'm like, well, here's a way that we could actually target that a little more and both support students to maybe learn how to do this, but also work with practitioners to evolve the skills more. So anyway, I'm not surprised by that. My observing is higher too, because I think the more you do this in practice, the better you get at it as well. So again, this was to address the mindful part of the clinical observation we were talking about. And so I'm proposing the idea that instead of just, the legal definition of clinical observation, that we did all agree with, it was accurate, it wasn't wrong what they said. But I think that what we do perhaps falls more into this. I actually coined this phrase. I didn't find it anywhere else. I think I made up mindful clinical observation. I might have. And I would say the elements of that, right? Those 2 elements, attentive observation means bringing one's attention to physical sensations, thoughts, and emotions. So again, that's much more than just your visual, take on something. And that it dovetails conscious observation, which we're doing, dovetailing the ability to identify, describe, and label your experiences. So being mindful about how you're observing and then being able to articulate it really well. Which, when I got there, I'm like, that's so awesome, because that is what visual thinking strategies is entirely about. It's about learning how to, it was, well, I'm getting ahead of my slides. Has anybody heard of visual thinking strategies before? Yeah, I know. Or been trained. If you haven't heard of it, then you definitely haven't been trained in it. So that's cool. That's okay. I do love sharing this with new groups because I think it lands really nicely for OTs specifically. So I'm going to talk more about where did it come from, what's it about, but we're going to start with with a VTS exercise. And it's basically called an exercise in close looking. If you look up the VTS website, that's what they describe. Doing VTS exercises, like the core of what you do in VTS is a facilitated close looking exercise. So that's what we're going to do right now. So I'm going to bring up an image next, and I'm going to ask you to look at it for a little bit. And then I'm going to facilitate us through the close looking exercise. You ready? You all ready for this? Okay. Okay. So take a minute to look at this image. I'm going to have to move away from the camera, and I apologize, but you'll see what I'm doing on the screen.
Man in a power chair with blankets, I think, over him. With a screen in front of him that looks like it's using some visual cueing. Got some sort of mechanism on his head. It looks like maybe a switch or something. He looks so proud of him.
Okay, thank you. So Katie, what you're saying is you're identifying some elements of this image right away, that you've identified this object, this figure as a man sitting in, I believe you said, a power chair. What did you say that made you say power chair?
I see his hand on his right hand on his right hand on the armrest there, and it looks like there's something blocking it, which makes me think it's a power chair. And then wheels.
In this one. Okay. And then you mentioned the other like elements of the image. So I think you identified this as a blanket for housing on him. Yeah, and then all the things, like this screen right here, and then the headset. And you mentioned something about, did you say a switch?
It looks like there's something on his head that might be considered like a switch to power something.
What can we find?
I did, I immediately saw like cleaning type things, and so I was trying to focus, yes. So Department of the Air Force, so he's a vet or potentially.
Yeah. So down to some more of the details of the image in terms of this, what Katie identified as a blanket, and now you're taking it like, what's the detail on the blanket? You're seeing what you're identifying here as planes, and then this Department of the Air Force is what you read here. So you're making some connection that this is about flying. Perhaps he was a veteran, right? Perhaps this is indicative of his status. What more can we find?
The thing that immediately I noticed was the expression on his face. I was immediately concerned if it was a surprise or if he was shocked or unhappy about what he's seeing on the screen or frustrated by technology.
What about his expression made you say shocked or surprised?
Open mouth and his wide eyes, you know, it's like, ah.
Okay, yeah, like it's a wow, like wow. So you can almost hear it. You're having almost, you can almost hear him. Okay. What more can we find?
My thought was that maybe he's struggling with communication.
What do you see
He's
that makes you say
attempting to, maybe he's had a stroke or something that's going on there. You know, maybe that's
Yeah.
like what he's wearing is to facilitate communication. It could his eye movements, maybe activate like speech somehow. I don't know. It's
Okay,
really
no,
wild.
no, it's okay. So- Okay, so you're saying potentially this piece of equipment is possibly a communication device? What do you see that makes you say that potentially
It's well,
communication?
because he's probably trying, maybe he'd like to speak, but like it's just a a reaction. I don't know.
What more can we
He
find?
looks like he's a spinal cord injury. You can see his left hand as well. So his left arm. Yeah.
I don't know, like, right, sort
Looks
of
like,
like,
well,
well, it's not me.
most of the left side, so he's.
Okay, so you're
His
not-
hand is flat, so you know he's paralyzed, at least on that side, with the joystick on the other side. That means he can't roll a regular wheelchair, so he's in the power chair for that reason.
So you're noticing some things about literally his anatomy that are speaking to you, possibly from your experience, your professional experience, about what it might mean, the shape of his hand, the flatness of his hand here, and what it might mean that this looks like he is operating a power chair in terms of what happened, did you say spinal cord? What happened to him that would require the use of a power chair rather than a regular chair?
And that's why he's using his eyes or that.
What more can we find?
Yes.
I'm stuck on the suspenders.
Yeah. So you're identifying this, am I got it right? You're identifying this as suspenders.
Well, I don't know if they're
So what
suspenders though.
makes you say suspenders though?
Those two straps, the
Yep.
black straps that go over the shoulders.
Yep.
I can't see the full left shoulder. But then at the same time, I'm not quite sure that they're suspenders.
Mm-hmm.
Part of me is like, are they some type of back strap? It's
Okay, okay.
Is it a positioning device? I'm not sure.
So, but your immediate reaction to those as suspenders would suggest that perhaps at some point in your life, you've seen somebody
Yes.
wearing suspenders.
Yes.
That appeared here, right?
Mhm.
But also are open to the idea that maybe it could be something else.
Correct.
Maybe it is a positioning piece of equipment, or
Yeah.
something for him as well. What more can you find?
So his expression, I took more as like surprised, but like in a good way, like, oh, like I've been able to communicate and now I can't.
Okay.
I saw one of us.
Okay, so you got another take on this, where we're kind of focusing on his facial expression, and so you're saying perhaps you got the idea of, nobody said shock and awe, I mean, like surprise or shock, but you're saying maybe it's actually wow, right? Yeah, this is whatever I'm doing here is a positive thing, I'm engaged, whatever, right?
I'm also wondering if he's communicating with either a therapist or a family member or a friend, because there is, looks like a camera at the bottom.
Right here?
Yeah.
Is that right here? Okay.
Or maybe that's reading his, like it was set over here, maybe his eye movements. Well,
Okay.
okay,
And so what about this makes you think maybe he's communicating with family? What did you see that made you say that?
I guess that was just an inference.
Okay.
Maybe with someone.
That's it. No, it's all good.
Screen, camera, he must.
But the idea, right, that there was equipment, the camera, and then the potential that maybe his eye movement was controlling some things, that he's communicating with somebody, it is, right? But that he's actually actively communicating with somebody through the use of this equipment that we're identifying.
There's a cord going on the screen, so something that's connected to something external.
You've identified this as a cord, right? And here's that pertinent negative, right? There's whatever's going on over here, we can't see, we don't know what's happening over there, but we've identified this as a cord leading to something else. Yes.
His expression looks like he's saying, oh, I didn't know that.
So it sounds like you're going with the surprise, kind of the surprise element, or did you identify that?
No,
as
there
different?
was shocks, but like maybe a pleasant surprise,
What do you see what do you see in his facial expression that makes you?
I see his eyes like he has it really up there. And his eyes are really open and his mouth is, it's not open wide, but wide enough to be not super exaggerated, but exaggerated enough so that the person on the other end could get an idea where he's.
Okay, so really like, intense, broad facial expression, like it's really, it's energized in a way that's making you say, pleasant surprise is what you said, right? Pleasant surprise. What more can you find?
I'm wondering, as far as the space, I don't know if it's necessarily facial expression versus he has some neurological involvement and it's a part of his work that he's using his face or are associated with work reactions, right, to trying to communicate. So maybe that there is that device on his head and he's trying to use it and the screen is giving him some feedback and it's just kind of like some associated reactions.
So Tim, you're sort of ripping off this idea of communicating, we've got the whole theme of just he's communicating somehow. You suggested maybe this is work related. And is that, yeah, or did you mean work related or that it's work for him to do this? I'm not sure.
It is work for him.
It's work, so maybe this is effort, maybe what,
Right.
so it's possible that this is effortful. And that's why his expression is like that.
Someone online said I think he may have ALS.
Okay.
And then I also wanted to make a comment to you.
Wait, can I ask others online something or no? They can't hear me. I want to ask them what they saw, what they see that makes them say ALS. I just have to see what I have to see what,
Because they're not hearing it.
I'm sorry, I know, it's really, I can't do it from here. Okay, I guess this is a tough one to do virtually like this. I saw some head nods though that other people sort of agreed that perhaps that was a diagnosis, potential diagnosis. Go in it.
Looks like the whole body is affected.
Looks like the whole body is affected, okay, and so adding to that idea of the diagnostic category, I believe somebody said spinal cord injury, ALS, we've had some very OT group responses, right, to this image. This was not a coincidence. This is the image we're using today, right? Okay, thank you for all of that input. That you've just experienced your first, sorry about that. VTS close looking exercise. What the heck was that, right? So what is visual thinking strategies? I think I started to say this was developed in the late 1990s by Abigail Housen and Philip Yenowin, who were cognitive psychologists, and they were looking at ways to use art with kids as a way to develop critical thinking skills. So they were actually targeting that ability to observe and describe what you observe, being left with some ambiguity, how you're going to manage ambiguity when you don't really know is there one right answer or not. And they felt that art was a way to get at this. And so this was the exact method that they used, was this close looking exercise, but they would do it. Somebody mentioned dosing of another thing earlier. They would do it, every day, or at least once a week with elementary school kids as a way to start to develop those skills of being able to articulate, to see, observe, and then articulate what you see and develop critical thinking. So they were working through the theories of Piaget, right? So that level of development, and also Vygotsky, that zone of proximal. Thank you. I'm with OTs, zone of proximal development, right? As a way of framing up how they should, make the facilitation work and how they should choose the images to use with kids. And so they always did it in groups, and that was intentional because the point was, and a bit of what happens every time I do, but what happened here too, is that you can see the way that the responses tend to build on each other, right? So could you do this in isolation? Sure, you could, but there is a lot more communal learning that happens when you do this as part of a group. And so, yeah, participants are meant to notice how they're engaging those skills, but also be thinking about how might I build these skills even more. And so VTS comes with its own set of goals that also gives us language for VTS. So again, we talked about looking carefully or close looking, which is what you just did. We spent 8 to 10 minutes on that image. How long do you think the average museum goer spends with a piece of art in a museum? 30 seconds, who said what? 30 seconds, 2 minutes. 8 seconds. Who said 8 seconds? You do win the gold medal. It's 7 seconds. And I'm not othering those people. I'm that person. On Friday night, when the Portland Museum of Art is free from 5 to 8, I go in the museum, and if I make it up all 3 or 4 floors, I'm like, I did the museum. And actually, all I did was be in the same airspace with a whole bunch of fabulous art. I did not do the museum. I didn't observe anything, right? So I am them, so I get that. But so that's VTS's whole point, is because we know that's how it works. What happens if a facilitator keeps saying, what more can we find? What more can we find? Well, guess what? We can keep finding more, right? It implies there's more to see. So we've slowed way down from that initial, our brain wants to go from what we see to interpreting it right away. My observation, my interpretation. Somebody said it earlier this morning, we were intentionally wired like that because it's for survival, right? I need to know right away if the mastodon is a threat or not. My brain needs to make that decision to do something really quickly. So we're made that way. Unfortunately, now as we've evolved, it doesn't work so well always to make a really quick interpretation all the time of what I just saw. So learning the skill of putting some space between what you see and how you interpret it is one of the main goals here for VTS. And then there's all this other language associated, developing visual literacy. I mean, there's every kind of literacy now, right? Health literacy, financial literacy. We also have visual literacy. What is that? Understanding and interpreting what we see. What happened here and what I was talking about, using it with kids, scaffolding on the thoughts of others. So, it happens in every group. Somebody hears somebody say something, and as I'm pointing, they're like, oh, I didn't even see that till you said it, but now I see this and it makes me think this. Well, that's richer learning right off the bat, right? We're building on learning as a group. Also, you guys were really good at this, holding a variety of interpretations as possible, right? We could land on one right answer, maybe, but not really. We don't know his name is Roger. We don't know what went on with Roger. We're a really educated group that can guess a lot of very probable things, right? But we don't know. And being able to hold that, like, maybe he has MS, maybe he has a spinal cord injury. We don't really know. And that's okay, right? That's the ambiguity. We don't know, and it's okay because it's art.
That's the hardest part, is, like, are we in trouble because we didn't get it right, we missed something?
Right.
That's what I was whispering to Katie.
Right. I'm trying to pound the OT education out of you. No, I'm not. No, I'm not. I'm trying to just expand that. It is okay. It can be okay to not know, but we have been trained to go for the one right answer most of the time. I think as healthcare professionals go, we are much more likely to, it depends, right? So much of everything we do is it depends. Our students know that, right? But I do think as healthcare professionals, we're looked at to get, what's the answer? Solve the problem. What's the one right answer? But maybe we can get the answer better if we allow for some more brainstorming in the meantime, right? So that's that one right, reaching incontrovertible conclusions. And then postponing, that's the part, postponing solutions, right? Did we solve this? Did we hammer out the meaning of this image? No, we weren't meant to, but we also didn't do it, right? So because we were putting intentionally some space between observing that and thinking through what maybe it could mean. The ambiguity part, that's a struggle, I think, for everybody. And I think that's an ongoing learning process of the not knowing. Every time I do this with my students in class, at the end, and you probably may want to do this too, they always want to, well, what's the name? What's the title? Who did it? Right? Because they can't stand the ambiguity. I don't know that, right? So by VTS standards, you're not supposed to give that information over because you're supposed to, that's what you're learning, right? How do I manage when I feel like this? How do I manage that when I don't know? I'll tell you, I told you this thing's wrong, but anyway, I'll tell you at the end, if you really won't sleep tonight, I'll tell you. And then this idea, and I think you may have felt this, the idea of community in developing new knowledge, right? So I know I thought more about different things about Roger by listening to all of you look at it and offer your ideas than I do on my own. That's because I've always worked in mental health, and I mean, I know that's a power chair, but that's about it. So why art though? Why am I taking art and trying to equate it to clinical practice? And so if you picture in your mind like a museum educator, right, at the Portland Museum of Art, with a group of people that they're going from painting to painting, and then you picture a clinical team, right, your interdisciplinary team. So we got these two groups. Well, what are they both doing? They're both paying attention and observing. They're both making multiple interpretations from their observations, right? We got these two groups. They're sorting through ambiguous evidence, collaborating with a community of observers, and then moving to consensus and developing a treatment plan or making some decision about what do we think maybe this means, right? So there are connections that maybe aren't obvious at first glance, but we definitely share some of those elements in a way that means, I think, that art can be useful to us in developing more skills. So to that end, VTS started with little kids, but research over time has brought it into higher ed, into use in higher education and in healthcare education. So studies using VTS have been done with nursing students, and it's the entire reason why I didn't go to nursing school, because how they did it with nursing students was they showed them a picture of a wound, and the nursing student, see, that's why I didn't either. The students had to write out their narrative description of the wound. And then they VTS'd them. I just used it as a verb. They did a lot of VTS. And then they, it had to be the same wound, right? It wouldn't make sense if it wasn't. They showed them the wound again, and their narrative descriptions were both longer and more qualitatively richer. They wrote more and longer things about it having done VTS. So there's a way that gets in your brain about how you observe and how you think that helps you describe wounds. But they also study medical students, dermatology residents. I don't know about you, but I want my dermatologist to have the best observation skills ever, right? So I think that was a perfect target audience for this kind of an intervention. There was a study of OT students not that long ago, and if you need this kind of validation, Harvard Medical School has run a course called Training the Eye that uses VTS for at least 10 or 15 years now. It's a semester-long course. That's how much they value it. And of course, they go to the Museum of Fine Art in Boston. They do like real museum stuff. But there's a testimonial video that has come from that. And one of the medical students said, by far, this is the best course I took at Harvard. And not because she said, is it fun to go to the museum? Yeah, but she said, the thing I really took from it is it really has helped me figure out how to slow down. So when I'm with my patients, I am so aware of slowing down. And yes, slowing down my observation, but just slowing down and being with them and being more present and aware. So if you have a Harvard trained physician, they've definitely done some VTS training. It's awesome. So we won't take much time with this. I was doing this research project at the same time that somebody else published the same research project about doing it with OT students. But the take from this is I did a very small study with a few of my students at USM, and the Kims that you just did, they did. And I was hoping for some big, like, their observation scale being like down here, and then we do VTS and the observations up here, and that didn't happen. There was absolutely no statistical significance in the Kim scores with my students whatsoever. But the qualitative results, my students were able to say how much doing VTS, and we only could get in 4 sessions across the semester, so still it wasn't a ton. But they said they began to use that in ways they didn't expect, like in anatomy, which makes a certain kind of sense, right? They were slowing down, they were observing differently. They were actually teaching other students who didn't do the research study about VTS and about how to do this. So they could definitely see an effect, and also the effect of observing in community and how much of a difference that made in terms of what they learned and what they saw because of their intersection with other people around it. So what's the takeaway? This is a lot of gobbledygook about mindfulness and vision and observing and all that. What is it that I was hoping that maybe you could take away today and use today? In terms of mindfulness and these visual thinking strategies, which of course you'd want to, you can have a pleasant experience. I hope it was doing this once, but developing those skills, you'd want to do VTS a whole lot more. I'm available if you want that, but now you have an idea of what that experience is like. But so what's the takeaway? I see it as the 3 prompt questions that the training facilitator asks during the exercise. I think we can use individually to support development of our observation skills. So for instance, the very first question, all I asked was, what's going on in this image? You could substitute what's going on in this situation, what's going on with this problem, right? It doesn't have to be an image. What does that address? What's going on in this image? That's the part where we're slowing down automatically, right? As a facilitator, is making us take our time, right? And so we're automatically, that is a cue to kind of slow down. It's the cue that we're also listening to other people. So we're starting to scaffold the knowledge already, even if we don't know it, just from that very beginning cue. But you could be in a situation yourself, watching somebody, you know, OTs, what do we do all day long? Watch people do the thing, right? While you're watching people do the thing, whether it's kids or adults or seniors, whoever it is, what's going on here? Can I get my brain in that space of, can I slow down and really attend slowly? And maybe I know you're all many of you are working in very pressured, we talked about productivity. I get it, right? Time is a huge element. But is there a way within that to think, to be where your feet are and to be present with how you're observing and to kind of have that be your sole focus? So that's a question you can ask yourself. What do you see that makes you say that, right? So as people were offering their interpretations or their observations of what was going on, the question is, what do you see that makes you say that that he's got this equipment on his head? Well, or what do you see that makes you say suspenders, right? Well, you know, that's where they would be if he was actually wearing, right? It's moving you to have to articulate your observations. And the more you do that, the better you get at all of those skills, at observing and in articulating what you're seeing. So you're developing your visual literacy, right, by yourself. So what do I see that makes me say that? You can do that for yourself. What objective evidence is here that's making me think I see what I'm seeing, right? It's again, putting some distance between your initial observation and your interpretation of that observation. And then that last, the last question, what more can we find? It suggests that there is more to find, right? And it helps to move us beyond oh, I very quickly got to the one right answer and that's what I'm going to do. That might be the thing that works, but it might not be. And if we're in a situation where we can help ourselves to, what more could I find here? If I have the time and the bandwidth to do that, is there more to see? And if I slow down, can I do that? If I keep pushing myself, what more could I find here? And I won't just stop at my immediate interpretation. This also helps us in that ambiguity place to, you know, develop some comfort with the not knowing of things. Questions? We're at questions. Yes. Oh, see? All right, you're not going to sleep tonight if I don't. I'm uncomfortable with the ambiguity. Okay, well, so next I have, these are just my regular references, and I'm answering your question. And then the VTS website is super cool. If you have a chance to check it out, it's a really cool website. And if you have more you need to talk about with me, you certainly can contact me. I have 3 art references on here because I didn't know if we were going to have time to do more than one. But he was Roger. And the artist is Mark Gilbert, who was in the advanced facilitator training, the same one that I took. And he is a medical humanities professor in Vancouver. And he has done research with a lot of people with a lot of various conditions, and he paints them. And so when we did the training, we did an online training in 2022, and this was the image that he brought up. When it was we all had to do one, and he brought this one up, and it took my breath away. And I went on his website and I looked at other stuff he's done. It's really amazing. And I thought, this is the image that a group of OTs need to pull apart like this, because of, right, how much we know, and we do know a lot. And sometimes it is sometimes it's a thing, sometimes it's not. And just even allowing space for all of it to come in, right, and not to get right to the, it's got. What do we said, ALS, whatever. I mean, I think that I don't know. I actually don't know what his diagnosis is. I don't. I just know that he's Roger, and that's the backstory of that image. So, okay, you can all sleep better tonight. Yes, John.
I just wanted to give you. Given that academia, and I was like, an adjunct. And I was going, help, I don't know what to do. Dr. Noyes is so helpful to kind of told me sort of about VTS strategies, and I use that as a lab in TV version of this to this day, and it's always interesting that students are like, I don't know, I don't see anything, and then by the end of it, it's 20 minutes in, and they're like, well, maybe there was a bird. They're going all over the place, and they just keep backing up everything. It's very interesting. It's one of my most fun labs.
Well, thank you.
Thank
For
you.
people at home, yes, that was, John saying that he has used this strategy after my English class to do it, and that students really benefited from it. And I also feel to say that Allison had to know, you probably picked that up now, what was going on with Roger, and that we don't know that, so. Okay, yes.
There was something that you had said about, community of observers. And I kind of want to start calling multidisciplinary around that.
Yeah, right? Yes, so there's a suggestion to call multidisciplinary rounds community of observers. Wouldn't that be, just the energy shift that creates in my head right now, and I'm not even doing that anymore. Right? The benefit of that, because couldn't that help everybody to maybe just dial it down? And, right? That's awesome.
No, that's, thank you.
You're free to take that and yes.
Yeah.
Right.
That Susan comes into my class and I teach on leading resilient times to change. And does the VTS, and we are trying to teach people to bring all their different perspectives and share the perspective and the ability to see what other people don't see, and then build up, oh, okay, maybe this and that. That is an essential element of community resilience building, is being able to see those different perspectives and being willing to suspend your own thought and listen to what somebody else has to say. And so, Susan's work is fantastic, and, you know, I suggest using it for many things.
Thank you. So for those at home, I've also done this in Brenda's class, and her teaching is about resilience. And so the takeaway typically for those students is about the learning in community and staying open to all potential interpretations of things and developing that skill set.
This really reminded me of personal development coaching. What that is when you have a coach who's working with you, but they keep asking you questions to dive deeper and deeper into you finding your own solution. So it's almost like there's a bunch of terms for it: transformational coaching, inquiry-based coaching, collaborative coaching, client-centered coaching, as the routines call it. And it's just asking layers upon layers of thought-provoking questions to the person you're asking them to get even more, have them come up with their own answers. Whereas you tell me.
Right, in that way, right, so Emily's seeing a similarity or a piece of VTS that does, that is similar to personal coaching methods of questions and the way that the questions are asked.
I feel like this is so helpful, and I was thinking about it in terms of like, in what state do I have to be in to observe carefully, and like that place where you can switch into projection, like this person has this, and I'm like, oh, I'm seeing that because I just had 5 months in that, or I had personal experience with that. But instead, we like are forcing people to go back and like, what are you actually looking at? Not what do you think might be happening?
Right.
And then the piece around ambiguity is so interesting too, because as therapists, like, I work with kids and like, I think they're really long gone before they really experience the depth of pains that comes from therapy, and I don't get to see that. And so this like little practice around just don't know, you have to figure out how to navigate that yourself to be a therapist. It just like feels like a really nice entry to that. It's like not very threatening, but like there is that sense of like, who is this?
Right, and I think many people's experience with art in particular is that, you know, we gotta beat this to death to figure out what the meaning is, right? And this turns that on its head. And I think the other part that you just said about being non-threatening, the express intent of VTS is that there really isn't a wrong answer. And that's the skill of the facilitator, to make sure that people understand. Somebody, I mean, I've had people say things that no one would have ever seen, but it doesn't matter. It's what they saw, right? And so it all becomes fodder for them. And so people are meant to experience it as very non-judgmental, very open and non-threatening. Yeah. And also acknowledge that Usually this is best done with small, usually 8 to 10 people in a group, as you might imagine, right? You can get to more people get to say more things. So the hour that we've had together today was like just screaming through mindfulness and VTS, that normally these things would be done at a much more parochial pace. So yes, there was a hand over the road.
Because they're only done studying that their gauge shifts from certain months, I don't know, but in that development, that it shifts from focusing on the face to like focusing around. I'm wondering if that would be a technique you could use to like have help them kind of come in on the.
It would be really interesting. If anybody is thinking, and that's why I'm suggesting the VTF website, if you are thinking that you might want to do this or learn, definitely take the training, because if there is more to it than I think it looks like when it's being done. But learning it would help you to know too. There very well may be application to that. And I think that would be cool to do and to research and.
They had in art galleries, they would have students and print a piece of art, a piece of paper, and they were all writing down things about.
Yeah,
So it's.
yeah. There's a lot of uses
Yeah.
for it, so. Well, thank you very much. Somebody must be coming up to say something now at 10 minutes before. Yeah, okay, thank you.
Thank you, Susan. Alrighty, we've reached the end of the conference. I would like to first thank you all for coming. Thank you again to those who presented today, our sponsors, Maple Hill Farm Inn for hosting today, our llama guest appearance, thank you to llamas, and everyone who worked so hard to bring this conference to life. I'd like to give a reminder for the evaluations. Please make sure that if you watch any of the recordings after today, you've watched and attended everything you would like to watch before completing your evaluation. You can find the evaluations at mainot.org or the FAOTA website. MEOTA also has other events coming up and happening. Be sure to check out your emails. There's the mental health SIS, which Susan hosts. They meet quarterly. The adult rehab SIS and children SIS and the book club. Again, all of this can be found on the website. Our next conference will be our fall conference on October 4th, and Katie Brandt will be our keynote speaker. Again, thank you, everyone.